Hi, Dr. Vo here. I'm a cataract and refractive eye surgeon. If you're watching this video, then you're probably interested in having laser eye surgery, but you want to know which procedure is the best option for you. There are three main procedures you should know about. That's PRK, LASIK, and SMILE. These procedures can be used to correct for your nearsightedness, farsightedness, and to correct your astigmatism. All three procedures use a laser to reshape your cornea, which is the thin surface layer of your eye. In today's video, I'll discuss each one individually, and at the end of the video, I'll give you a comparison of the pros and cons of each one. First, we'll talk about PRK, which stands for photorefractive keratectomy. This is the oldest of the three procedures. During PRK, the epithelial layer, which is a thin layer on the surface of your cornea, will first be removed. The laser will then be used to reshape your cornea. This is the key difference between PRK and LASIK in that no flap is made during PRK. A bandaged contact lens will then be placed onto your eye and it will be allowed to heal. During the recovery process, you'll experience mild to moderate discomfort as the epithelial layer heals. This can take anywhere from a couple days up to a week. Your vision will also typically fluctuate during the recovery process for PRK, and this can last anywhere from a couple weeks up to a couple months. PRK is generally recommended for people who have thinner corneas who are not a candidate for LASIK, or for individuals who are involved in contact sports or any sort of activity where they are at risk for ocular trauma. Next, we'll discuss LASIK, which stands for laser-assisted in situ keramolysis. This is the most commonly performed and most popular of the three laser-based procedures. During LASIK, a thin flap will be made in your cornea using either a blade or, more commonly now, a laser. The flap will be gently lifted up, and a corrective laser will then be used to reshape your cornea, similar to PRK. Afterwards, the flap will be gently placed back down onto your eye, and it will be allowed to heal. The main appeal of LASIK is the fast recovery process. You will experience little to no discomfort, and your vision will improve within 24 to 48 hours. However, to be a candidate for LASIK, you will need a thicker cornea than in order to be a candidate for PRK. Finally, we have SMILE, which stands for small incision lenticle extraction. This is the newest of the three laser-based procedures. During SMILE, a laser is used to create a small disc-shaped piece of tissue in your cornea. A small incision is then made into your cornea, and this piece of tissue is then removed, which will reshape your cornea and improve your vision. Similar to PRK, no flap is made during SMILE. The recovery time is also pretty quick. However, your vision may take longer to stabilize during SMILE when compared to LASIK. Okay, now that we've discussed each procedure, let's go over the pros and cons of each one. For PRK, the pros would be that it's suitable for thinner corneas and no flap is made, so there's no risk for flap-related complications. You're also less likely to develop dry eyes. The cons would be the longer recovery period and the mild to moderate discomfort you'll experience during the initial recovery. For LASIK, the pros is the fast recovery. You'll experience little to no discomfort and your vision will improve within 24 to 48 hours. The biggest cons is that you do need a thicker cornea in order to be a candidate for LASIK. You're also at slightly higher risk for developing dry eyes, and the creation of the flap puts you at a low risk for a flap-related complication. Lastly, for SMILE, the pros again, no flap is made, so you are not at risk for a flap-related complication. The biggest cons is that it can take longer for your vision to stabilize when compared to LASIK. And there you have it. That's a brief overview of comparing PRK versus LASIK versus SMILE. Each procedure has its own pros and cons, and the ultimate decision about which procedure is best for you really will depend on your individual eye and also your preferences. Your surgeon will discuss which option is best for you. If you found this video helpful and you'd like to learn more about eye surgery, please check out my video about cataract surgery. And that's all I have for today. I'll see you in the next one. Bye!